So I'm late on my video assignment. I had 3 hours of sleep yesterday. I worked overnight in an ambulance, and I did my work yesterday, and then I passed out. I completely forgot. I mean, it didn't even occur to me that I needed to get this done. I was dog tired. Um, but after completing school today, I realized that it was still on my list to do. So I'm going to do it. So for positioning the patient, there's what is that? There's supine, Fowlers, semi-Fowlers, Sims, prone. So the first thing that you'd want to do when you go into the room, besides hand hygiene, introducing yourself, checking the chart, and providing privacy, is you would want to move the bed up to a comfortable level and see if there's anybody to help you, because it's going to be more comfortable for the patient, probably a little bit safer if you have two people. But for a patient laying supine, you would go in, and let's say that they are all crazy on the bed. So you're going to want to lay it flat as tolerated, as flat as you can make the bed. You're going to want to make sure that they are totally supported, and all of their voids filled. So underneath their head and shoulders, that can be done with a pillow. You would need to support their arms. Pillows are really nice to be able to support their arms. And if they need their void in their back filled, make sure to ask. They may or may not. They might possibly need a pillow underneath their knees. And if you're trying to prevent pressure ulcers on the heels, you would want to place a pillow underneath their ankles to elevate the heels off the bed. There's rolls you can use for positioning patients. Supplies, you could use the trochanter rolls or towels rolled. You can use pillows, you can use blankets, you can use wedges, whatever is comfortable for the patient. And then also positioning the patient in bed. It's really helpful to have a draw sheet underneath them so that you can move them, because they might, if you have them in a semi-Fowlers or a high Fowlers, they could kind of scooch down. So you're going to need that. If you want to roll the patient onto their side, again, lay the bed down flat, and if they can tolerate it. So what you're going to do is you're going to move the patient to a side, move the patient to the side, to one side, and have the bed rails raised, and then you would need to go over to the following side, the other side, so you want them to roll towards you. So tips for rolling across the legs. They can roll easier. Make sure that the arm that's close to the mattress is laid flat along. That way they can log roll onto their side. And so once they are on their side, and you need to move to the other side where you're further away from them, you're going to put the side rail down, and then you're going to help facilitate them rolling on their stomach. If they're going to go on their stomach, you would need to support the abdomen before you do that. You would need to place a pillow there. You would need to make sure that their voids are filled. Their head is sideways. It needs to be supported with a pillow. And if their shoulders need to be supported, if there's a void there, their arms should be along the sides of their body, along the mattress, and you would need to support their feet at all times, depending on pretty much whatever position that they're in. You would need to have towels rolled up or a wedge or something to support the dorsal flexion of their feet, and that's to prevent drop foot also. And so gone over everything for the supine, or I'm sorry, moving from supine onto the side to prone position. If you were to leave them on their side or decide to do a Sims position, you wouldn't move them all the way over to the side of the mattress for that. That is fine if they're like in the middle of the mattress and then they want to roll to their side. You would want to take their one of their legs and have it at an angle to their hips and their legs. You would need to have it at like a 45-degree angle. You would need to pad in between the legs on both, put a pillow under there. You would need to support you'd want to keep the arm in alignment with the shoulder, and then you're going to support that with pillows to keep it in nice alignment. You're also going to want to lay pillows or wedges, whatever you have, to support the spine while they're on their side. They're laying on their side. And you would need to make sure that their head is really supportive, because if they're in a Sims position or on their side, they just need to make sure that they're really nice and supported, that their cervical spine is in alignment, their joints are all in alignment, and every single thing is padded, front and back, really. So the Fowler's position, full Fowler's, needs to be is at 90 degree. A semi-Fowler's is at a 45 degree, and obviously supine, I mean, I'm referring to that as like flat, and then the prone's also flat. So can't elevate it when you're prone. So that's it for positioning the patient. When you're done positioning the patient, you need to make sure to put the bed back down. I mean, this is going to depend on facilities, procedures, but you're going to put the bed back down. You're going to need to make sure that the call light, wherever you're going to put it, it's attached to something right next to the patient so that they have that available to them. And you're going to document it, anything that you find or see, or any pain that they're having when you're moving them, or their level of pain before and after. It's just part of your nursing assessment, and that needs to be included. And then you're going to leave the room in the condition that you found it, tidy up. That's all needs to be incorporated into each visit.